Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Today I'm going to talk about your feet, and particularly one problem people have with their feet. This is going to be very interesting. Um, you ever had problems with your feet? I mean, who hasn't? The average person is going to walk in their lifetime 150,000 miles. That's like walking around the globe 6 times. So if your feet hurt or they have some kind of deformity or infection or neuropathy, you're going to suffer and it's going to become a major problem for you. The number one thing with longevity is movement. And if your feet are hurting or they can't perform, you're not going to move. So that's a lot of walking, isn't it? Your foot has 26 bones in it, making it really one of the most intricate parts of your body. And if something is off with your feet, you're going to know it. I mean, look how big the shoe industry is. My dad always said, don't skimp on two things, your shoes or your mattress, because you're going to spend most of your life in one or the other. So it's very important. The structure of your feet is so important. It's so different for everybody. The thing about it is you could have your arch is too high. You could have flat feet, which means you don't have any arch. You could have bunions. You could have hammer toes. You could have plantar fasciitis, corns, which are calluses. You could have heel spurs. You could have claw toes. You could have metatarsalgia, which is very common, especially among people in my age group. You could have diabetic neuropathy. So if you have one of these common conditions, it's going to severely limit you in the way you're going to promote your health. It can be painful. It can lead to infections. It can limit your movement. And those are all important for longevity. But really today, so we need to talk about feet more often than we do. They're very important. That's one reason they have podiatrists, foot specialists. I use them all the time in my practice. But I want to talk about one particular part of your feet that I see so commonly, and that's fungal toenails. That's a really difficult problem. And you've seen people with this, you may have them. I mean, it affects millions of people. And it's usually, the problems caused by this, a lot of times they can be purely cosmetic, but it can also lead to infection. So, and they just look awful. So, you need to probably get rid of that fungal nails. It's called onychomycosis, and it's caused by a fungus that causes thickened, brittle, crumbly, ragged nails. It's caused by a particular fungus called Trichophyton rubrum. And there's 3 million new cases in the United States every year of fungal nails. It's pretty easy to diagnose, really. It's hard to treat. It can last a lifetime. Of course, it's more common in old age. It's rare in kids. And, I won't say it's easy to diagnose. It's easy for me to diagnose it because I've seen a lot of it. But sometimes you can confuse it with some other conditions like psoriatic nails or just damaged nails. But usually when it starts to get that thickened, yellowy appearance, you can usually tell what it is. If there's any question, you can always, do a biopsy by taking a nail clipping. The podiatrists and dermatologists do this all the time. And sometimes as you get older, your nails just become a little more thick anyway. But when I look at a fungal nail, I can usually tell it. You're at increased risk of this if you have had a lot of athlete's foot in your lifetime, which is a skin condition, fungus of the skin, caused by the same general fungus. You have more incidence of it if you have cancer and receiving chemotherapy. Have had previous nail infections, injured a nail. A lot of times I'll see damage to a nail that will lead to a fungal infection. If you have poor circulation, I'll see this a lot because I do a lot of work with veins, spider veins. And a lot of these people have fungal nails because of circulation. people that are immunocompromised. If people in your family have, a lot of fungal infections, you're more compromised with that, more likely to get it. If you have psoriasis or a lot of skin conditions, you're more likely to get it. So it's really common. Sometimes it's unsightly. Sometimes it can lead to infections and become painful. Your lifestyle has a lot to do with it. Your increased risk if your feet are wet frequently. You smoke. You walk in your bare feet in humid places like around pools, public showers, or locker rooms. You wear tight-fitting, closed-toed shoes, especially if your feet sweat a lot. You're more prone to this. Most people get this when they have skin contact with somebody who has a fungal infection like athlete's foot. So it's contagious. You can also get it by sharing nail clippers or towels. So please don't do this because it is contagious. But you don't have to catch it from somebody. Funguses are all among us, so to speak. So it's everywhere. It's just that right condition. You may have a crack in your nail or in the skin beside the nail, small cut, and this fungus can get into that and cause this stuff. The area under your nail also provides a warm, moist place to grow. It loves that. The infection can spread to other nails or even the skin. It's weird how a lot of times I'll see it on one foot and not the other. I think this is probably because of circulation in the one foot. And sometimes you just see it on one nail, but a lot of times it'll spread to other nails. But usually it starts out as a discolored yellow spot on the nail, and then it grows. It's slow growing. You're more prone to get fungal nails if you're stressed, immunocompromised, or have had a lot of antibiotic treatments. Treatment of nails, that's a tough part. There's topicals, there's oral medications, and then there's surgery. Topicals really have kind of a low cure rate. Oral medications are pretty effective. They can have side effects. Nail removal, you got to think about caring for the wound afterwards, and it can still return. So remember this, it's a long process. Toenails can take from 12 to 18 months to grow out in their entirety. So it's a stubborn infection. You got to be patient when treating fungus of the nails. Topicals, the first one that came out, I think, was called Penlac. It has about a 12% cure rate. That's not really good. Jubilee is the one you hear advertised all the time. And it has a better cure rate, but it's really expensive. Now, I have heard of some of the specialty pharmacies being able to get this kind of generic-wise, and I've heard it in one place for $60 a month, which is cheap for that because Jubilee is expensive. So I always check that out. But it's out of the topicals, that may be the best brand name one. But topicals work better if you do debridement first, either manually with a podiatrist or use a urea product. You can do that. It kind of thins the nail out, makes it more penetrable for the topical. There's the brand name of urea called Cerevel. It's about $20. It's a prescription medicine, but you got to keep that covered under a tight water-occlusive bandage. So it's not real practical. And it's usually performed monthly by a podiatrist who's also trim your nails up. So that's kind of onerous. There's a daily compound, which is a combination of urea and a medicine called clotrimazole, that is probably the best topical. So you can get these from compounding pharmacies. It's still not perfect, and it's not as good as the orals for sure. And, there's a lot of over-the-counter home remedies too. You talk about tea tree oil, coconut oil, Vicks Vapor Rub. They do have antifungal properties, but with the OTCs, you usually get recurrence in my experience, so they're not greatly effective. The orals work better than the topicals, no doubt about it. Lamisil is probably the best one, terfenadine. It's got about a 76% cure rate. Sporanox, which is itraconazole, has just about a 63% cure. So I think the oral Lamisil is better. The diflucan, which we use more for yeast, does not work real well for fungal nails. But you'd have to take this daily for 6 to 12 weeks. And, you're going to have to take this for a long time. Like I say, 2 to 3 months. If you made the mistake of taking diflucan, it's 3 to 6 months. So it's just not practical for that. But, I use a lot of Lamisil orally. The thing about it, it can affect your liver. That's the downside. So you need to get liver function tests before treatment and then midway through your treatment. Then you have to worry about recurrence as well. So you got to do those things that will prevent it once you kind of cure it. So watch out for the liver function test. What about lasers? Really, right now the technology is only there for more cosmetic reasons. So it may thin it down and make the appearance get better, but I don't think it's really going to cure it too much. I haven't found that to be real effective. Really, if a nail won't respond to topicals or orals, you're talking about surgical removal. And sometimes they even have to permanently remove the nail if it recurrent. I mean, I've removed many nails myself for fungus. And unless you create the right conditions for not having it recur, it's going to come back again with it. Then you have to permanently take the nail off, which really is done better with a podiatrist. They can permanently remove that nail by using phenols at the base of the cuticle after they take it off. They used to do a lot of burning, but I think they usually use phenol right now. I used to do some of this for the corners, like when I would remove an ingrown toenail. I used to love to work on toenails for some reason, but so this can be done. And if they don't permanently remove it, they just do temporary, you're really going to need to use a topical as the nail grows back in. So you got to remember that. It really works at the base of the nail called the cuticle. These topicals penetrate somewhat, but it's really the action they take at the cuticle that will cure your nail as it grows out. But you got to be patient. It's going to take a long time for that new nail to grow out, average of a year, like I said. So it's hard to treat. It takes time. It's stubborn, and it can recur. Now, I want to give you some practical tips on nail care as well. Watch out for pedicures. I'm not saying you shouldn't have them, but you need to look at where you're getting them, because I think a lot of infections and fungus are spread by this. The tool needs to come out of the autoclave, the sterilizing machine, and don't let them mess with your cuticles or dig and try to get a nail out of the corner. Do not let them dig on your nails. Have them just do your pedicure. Don't let them get too deep into this thing, or you'll get infection. That's how it spreads. That's how it's caused a lot of times. Toenail polish, I'm not against it, but if you have a fungus, do not use toenail polish on top of it. And there's all kinds of toenail deformities that we see, like a pincer deformity, where both the edges of both nails are clawed in like that. That can be a really painful deformity, lead to a lot of ingrown nails and a lot of problems. They're very curved, and a lot of times the podiatrist will permanently take those corners out. So here's another great practical tip that my dad told me when I was a kid. When you cut your toenails, cut them straight across. Do not curve them, and don't try to dig them out by yourself. That's when you get infection. If you have a slight irritation that could lead to an ingrown toenail, let it grow out. Soak it and let it grow out. Don't try to dig it out yourself. So cut your nails straight across. And if you can't cut them properly, say you're old and can't bend down to get to them or can't see them properly, get somebody like a podiatrist or somebody who's expert in nail care that can take care of this, that's maybe your provider. Very important. Take care of your feet and your nails. We'll talk more about feet in general at a later date, but mostly this was on toenails. So take care of your toenails. It's kind of like taking care of your teeth. It's very important for your overall health. It really is. So, little ditty on fungal toenails and feet in general. Take care of your feet, because your overall health could really depend a lot on this. So I hope this helps. Fungal nails, foot care. Think about it. It's very hygienic. I hope you take something that you've learned from this, and I'll see you next week. Thank you.